Welcome to day one of Navigating Gender Affirming Care in Massachusetts. My name is Leslie Diaz. My pronouns are she, hers, ella, and I am a tan Latina woman with Black wavy hair. I am from My Ombudsman, and we are co-hosting this virtual event in collaboration with some wonderful people from Fenway Health, Health Law Advocates, and Trans Resistance MA. So thanks so much for helping us put this event together. The idea for this event came about as policies and resources started popping up here and there for people who have been seeking gender affirming care. And there's so much information, knowledge, and advice out there, but where do you even begin? And what should you expect as you start embarking on that journey? So I'll introduce our first panel of presenters who will talk about where to go for your healthcare needs. We have MG Jiang from the Massachusetts Transgender Political Coalition. We have Claire Powell from the Edward M. Kennedy Community Health Center, and Dr. Hannah Wenger from Massachusetts General Hospital. We are so excited to get your insight on this topic, where to go for your healthcare needs. And so I would love to have you take it away, and let's get into it. Thank you.
Thanks, Leslie. Hi, everyone. I'm MG Zhang. I am Hmong, wearing a white tee and a fresh haircut. I use they, them, theirs pronouns, and I'm the programs manager for the Massachusetts Transgender Political Coalition, more easily digestible MTPC. I am super happy to be here. Apparently, my cat is as well. Sorry about that. And I have some materials to present today for some overview, and then happy to take questions with my fellow panelists as well. Let me just share my screen. All right. If everyone's able to see that, hopefully all good. Yeah, so gender affirming care in Massachusetts. MTPC is not a provider or healthcare organization in any capacity, but we do advocate for trans affirming healthcare and trans people across the state and in the United States. And so just a little bit about us for background and some context. Our mission, we work to ensure the well-being, safety, and lived equity of all trans folks, non-binary people, and gender expansive community members in Massachusetts. A lot of our history is wrapped up in political advocacy and securing legal protections for trans and gender expansive individuals in the state. And now, as we have fortunately secured some of those protections in Massachusetts, we are shifting towards community-oriented programming. We are the oldest by trans for trans serving organization in the nation, founded in 2021. And you can see us at our steering committee, us MTPC members and our steering committee members at an event this past July. My cat is saying hi, so I apologize for that. And so in starting to find gender affirming care, this is a process that I know both professionally and one that I've gone through personally, coming to Massachusetts from out of state, and being in a place where there are more progressive options and where I had my own health insurance for the first time. And I know personally that it can be daunting to even know where to begin, and finding information on Google isn't always that easy. And so I wanted to kind of overview a starting place for folks as well. One of the programs that we run and that I direct is the Trans Health Coalition for Massachusetts. And this is a coalition of 60 plus medical providers and personnel. We have health law advocates, people experienced in policy and bill tracking. And this is a coalition dedicated to providing, securing, and advocating for gender affirming care for trans and gender expansive folks. And so I wanted to highlight this program because it is a great starting place in terms of organizations that are a part of it, as well as a community forum, which I will talk about in a second. Another great place to start is Transgender Healthcare Access Massachusetts, which you can find at transhealthcareaccess.com. This is created by one of MTPC's steering committee members and highlight some of the ways in which we can self-identify transphobia in doctor visits and what healthy primary care relationships look like. For the Mass Trans Health Coalition, we are in a place of development. Some of my co-panelists and other members are part of the Trans Health Coalition, and we are looking to become more community-oriented, to be more forward-facing and available and accessible to the public. So what that may look like in the future as we grow, and currently is a question intake from community members where people can have a place to ask questions rather than, paying for a doctor visit just to ask a basic question, but a online forum where you can submit a question and a network of providers can answer it to the best of their knowledge and their ability with, certified professionals. And so you can currently do this by emailing info@masstbc.org. And this is a starting place on where to receive gender affirming care, what options are available, navigating health insurance and healthcare in general. And then we have recently developed some working groups where it's kind of like subcommittees to the coalition. One is patient navigation support, and another is bill policy and tracking. And so these are both in tandem, work together for our advocacy and like I had mentioned, being kind of community facing and a resource for the general public. Whereas right now we kind of operate internally, we're looking to build externally. And more on Trans Healthcare Access Massachusetts. So Nick Tompkins Hughes, they are one of our steering committee members for MTPC, and they researched and developed this research project and proposal at their time at Bridgewater State. And it entails and details the experiences of navigating and finding medical care while trans, specifically in Massachusetts. So obviously incredibly relevant to today. And some things that I personally found helpful and that I think might be helpful for others is that it details experiences of trans adults seeking and receiving medical care and instances of transphobia that we might feel compelled to brush off, but what we can actually do in the event that that is encountered during our encounters with medical care. And also defining trans knowledgeable and inclusivity and what that looks like in practice and how we can hold our primary care providers and medical personnel accountable to being trans knowledgeable and trans inclusive in our spaces. So those are two of the main things. I am by no means a provider, but from the community programming aspect, wanted to share these resources that are available to the public and great places to start when the Google search isn't really turning up any results. And I can put my email in the chat for folks as well, if you'd like to contact me.
This is Leslie. Thank you so much, MG. Wonderful information and a really great place to start when, like you said, don't know where to turn and Google isn't doing it for you. So really appreciate it. And also a really great way to get politically involved and involved in your community. So really awesome information. All right, so I'll see if Claire and Hannah want to take it away with the rest of the panel.
Yeah, absolutely. This is Claire. My name is Claire Powell. I am a white trans woman with dark curly hair, wearing a dark floral top, and my background is blurred. I use she, her pronouns, and I am a community health worker at the Kennedy Community Health Center in Worcester, Massachusetts. I'm just going to bring my presentation up on screen just because the first couple slides are a little bit more context than what that is. As I'm bringing it up, I don't know if I have on-screen text image descriptions, so I'll try to provide that verbally when I have images in the presentation. All right, so on screen, there's a picture of the Kennedy Community Health Center. And in front of it, it says that just that this is the Edward M. Kennedy Community Health Center Trans Health Team. So our history as the Kennedy Community Health Center, we are a federally qualified health center that provides primary care, urgent care, dental, optometry. We have a pharmacy on site. We also include behavioral health treatment and a lot of programs such as substance use treatment, women's and reproductive health, HIV/AIDS services, and other specialties. And among those, the Trans Health program is relatively new, but it is really, really exciting. So just a little bit about our history as a health center. We were founded as the Great Brook Valley Health Center in 1972 by 7 women who lived in public housing nearby. We have a whole number of sites in Worcester, Framingham, and Milford. We serve over 29,000 patients a year, but that's the health center as a whole. Right now in the Trans Health program, we have about 130 active patients. And the only image on this slide is just the health center logo, celebrating sort of our 50-year anniversary. In terms of the Trans Health program specifically, we provide gender-affirming primary care, gender-affirming hormone therapy, hormone injection teaching for folks who are receiving gender-affirming hormone therapy and are using injectable hormones. I also, as a community health worker, work on a lot of kind of non-medical resources, such as, thank you, I will slow down. Work on a lot of non-medical resources, such as referring people to other resources in the community, referring people to, you know, if folks are looking for surgery or looking for housing or something like that, that's part of what I do. And we currently in the program see patients of any age. People just need to have a primary care provider at the health center. We don't provide hormone blockers at this time, but that's just because we don't have the capacity to do that yet. And we see patients who are on blockers and will often refer them to a nearby hospital or to Fenway Health. The only image on this slide is just a Healthcare Quality Index Leader Award that we got from the Human Rights Campaign. Those awards they can be a starting point for trans-affirming care. What they can indicate sort of at their best is a level of official commitment to providing gender-affirming care from a health center. But, you know, there's enough overhead in applying that not all gender-affirming centers will have one. And that's a baseline. Doesn't necessarily mean that it is doing everything that we would want, because there's always room to improve. So a few things that I have about seeking gender-affirming care, the 3 most important things I'm going to say. The first thing is, if you are working with a therapist, a doctor, a surgeon, and it feels bad, it is probably bad. So trust your instincts on that. If you get a negative feeling from a provider or an appointment, if it makes you uncomfortable, trust that. Second thing I'll say, going off of that, is there are doctors who will help you access gender-affirming hormone therapy and surgeries and care while being supportive. This is one of the main things I want to say today. Yes, there are a lot of barriers to gender-affirming care, but these providers exist. So if you're seeing a provider who does give you that bad feeling, or you feel like you can't find anyone, that's not just something trans people have to live with. That's not just part of what medical care is like. So you are seeing a specific provider who is not doing their job, or you haven't been given the resources you need locally. And there absolutely are resources out there so that you can find gender-affirming care. And that kind of leads me to the third part of what I want to say in this kind of introductory presentation, which is really going out to folks who are just now looking for gender-affirming care, which is that if you are looking for gender-affirming care, if you are looking to transition, you can do that. Some things might take longer. Some things might have some resource barriers that take more research to get past, but there are a lot of resources out there to get the care you want and the care you need. So far, I have not run into anybody where it has been impossible to find them support, to find them gender affirming care. It doesn't mean you can do that on your own. It means that people are out there who are going to be able to help you. The last thing I want to talk about here is the informed consent model of gender affirming hormone treatment, which is just something, not all gender affirming care includes gender affirming hormone treatment. Our trans health program includes both patients who are receiving hormone treatment and patients who are not. But it is a major thing that people often want to know more about. And so I just wanted to talk about here. So we and many other clinics prescribe gender affirming hormone therapy, and you'll see the acronym GAHT for that under the informed consent model. So the informed consent model means that for folks over the age of 18, your provider will discuss risks and benefits like in any other doctor's appointment for any other medication. Your provider will review expected changes, possible changes, what timelines might be. Your provider will tell you, what changes are often permanent, what changes often will continue to change, even if gender affirming hormone therapy is stopped. Some centers will require you to sign an informed consent form, which is just, it looks like a contract and it just lists out that you'll sign, yes, I understand how all of this works. We don't, because we feel like this can just be like any other medical care where you talk about it with a trusted doctor and then you get the care you're looking for. But you will have just on paper a list of here's everything that right now that research says can happen, might happen with gender affirming hormone therapy. And you'll have the opportunity to ask questions and express concerns. And then from there, from there, you will be able to receive gender affirming hormone therapy. That means there's no required therapist letter for it. There is no required, sometimes there's a wait list for an appointment, or we'll have a kind of primary care intake, which means that it'll be 2 appointments. But what that means is maybe you're waiting a few days, maybe you're waiting a couple weeks. You should not be waiting months. And I say you should not be waiting months because there are places that will do this safely in less than a couple of months. So if you see someone and they say, yeah, well, the only way you can receive gender affirming hormone therapy, the only way you can receive gender affirming care is with some process that has like a 6-month wait and a therapist letter and 10 different appointments. They're telling you their process. They're not telling you the process that can exist, because there are lots of centers that provide gender affirming hormone therapy on an informed consent model in the state of Massachusetts. For folks under the age of 18, the law right now, and so this is going to apply for pretty much any health center, is that all legal guardians must consent to gender affirming hormone therapy. But that's again on an informed consent basis of those legal guardians. That again, that's not, and also there's 20 different appointments and you need 5 different therapist letters and you have to wait or anything like that. It just means that right now the law requires that legal guardians consent as well. And one example of another resource that I love to direct folks to as well is Planned Parenthood in Massachusetts has done a lot of work to have incredibly low barriers to receiving gender affirming hormone therapy. So through Planned Parenthood, it can even be 1 or 2 telehealth appointments. The only thing about that is they're not a primary care provider. So then also, I would recommend finding gender affirming primary care somewhere else as well. But they have done a lot of work to really make that barrier incredibly low, including for folks who are completely uninsured, and they are very flexible in working with people. For other folks, though, most college insurances, I think every insurance I've seen for college insurances covers gender affirming hormone therapy and gender affirming care. Mass Health Standard and most forms of Mass Health cover this. So for most people, this is covered. The only times when I run into any issues with insurance coverage working with patients is sometimes for undocumented folks, their insurance won't have full coverage. But even then, there are pharmacies and clinics that will work with people on a sliding scale model. So there are plenty of options for accessibility. On this slide, there's a picture to the left that's a sort of illustration of what informed consent means. It's a sort of blue wheel, and the center says informed consent, and around it, it just lists components of that. So that's just the nature of treatment, what alternatives there are, what benefits there are, the risks, and an opportunity to ask your provider any questions that might come up. And so that's kind of that just further illustrates what we mean by informed consent. That's everything I have. So I'm gonna stop sharing my screen and then pass it over to Hannah. And then we have some panel questions as well to go over in a little bit.
Wonderful. Thank you so much, Claire. This is Leslie. Sorry, I meant to say that before I started speaking. And I will let Hannah take it away. Thank you so much for being here. And so far, thank you, Claire and MG, as well, for the great information you provided.
Awesome. Thanks, Leslie. Hello, my name is Hannah. I'm a white queer woman. I use she pronouns. I'm wearing a white sort of cream blouse and some earrings that were beaded by a Navajo artist named Betty Begay, who's based in Flagstaff, Arizona. And my background is blinds, and then at the window, I hope it's not too bright. Please let me know if that's the case. So I'm here not as a physician, but as a resource. I am a gender physician. I have worked, I no longer work as of this week at Mass General Hospital, the Trans Health Program. But my areas of interest are Indigenous and gender health, and I do a lot of gender health in Indian country. I am here primarily to share some information about gender affirming care access for Indigenous folks who live in the state of Massachusetts, and or who are like around the region and interested in connecting to community or to care within Indigenous or non-Indigenous spaces. I want to just be clear that I'm here not representing tribes or any tribal or federal entities, including the IHS or any tribal health systems. So I'm going to review a few key healthcare considerations, primarily focusing on Indigenous persons who are eligible for healthcare benefits through the Indian Health Service. So I'll use the term American Indian and Alaskan Native a lot because that is the primary terminology that connects directly to what it means to be able to access healthcare benefits within the Indian Health Service. But I can also speak to resources for other Indigenous folks. So I'm going to give a little bit of data here. I don't have any slides, so I'm just going to be using my words. There's no there's no other things to share here for you. But based on US Census data, there are about 50,000 individuals in the American state of Massachusetts who identify as Native American, either alone or in combination with another race. American Indian, Alaskan Native tribes are sovereign political nations within the US, and they include 574 federally recognized tribes, as well as more than 100 state recognized tribes. Individuals who are enrolled in federally recognized tribes are eligible for healthcare resources through the Indian Health Service, or the IHS, which is a federal agency that oversees a group of federal, tribal, and urban medical centers for American Indian, Alaskan Native people. I am sorry about that. I am also going to try to slow down. Thank you. And these health systems are across the entire country of the United States. The New England region contains several healthcare sites for American Indians and Alaskan Native persons. Within Massachusetts specifically, there's the Mashpee Wampanoag Service Unit, which is a federal healthcare system in Mashpee. There's Native American Lifelines of Boston, which is an urban Indian health program based in West Roxbury. And there's the Wampanoag Health Service, which is a tribal healthcare system in Aquinnah. Each of these clinical sites or locations provide different types of resources that can include medical and behavioral health services, but each varies in different ways that are important to clarify if you're approaching care in each individual place. Gender affirming care, including medical and behavioral health services, are available within federal and tribal healthcare facilities, though, across Indian country. For example, I have an exceptional colleague who provides behavioral health services through Native American Lifelines in Boston and Baltimore. I also can confirm that the IHS does directly cover hormone therapy for gender affirmation for queer individuals across the lifespan. Surgical care is not available within the Indian Health Service at this time for gender affirmation, and it is not routinely covered for referral care based on funding and policy reasons. I do want to emphasize that for American Indian Alaskan Native persons who are seeing a healthcare professional in Massachusetts or in a federal, tribal, or urban Indian medical program, there are resources to help you get the care you need. I specifically want to highlight some community resources that you can explore at the Paths Remembered project, which is a health equity initiative for Two-Spirit LGBTQ+ individuals that's based at the Northwest Portland Area Indian Health Board, which is a health board with whom I directly work. I will drop that link into the chat after I finish these comments. I also want to alert you to Indian Country Echo, which is a cost-free program that helps healthcare professionals provide gender-affirming care to Indigenous people in an intersectional way by both acknowledging gender diversity and indigeneity in care. I am one of the faculty members who works in this ECHO program, and I directly coach healthcare professionals as they navigate how to provide medical and behavioral health services to American Indian and Alaskan Native people. Those are generally my comments here. I'm going to stop, but I also will drop into the chat information on the different IHS facilities within the state and within the region, as well as the link to Paths Remembered and Indian Country Echo. Thank you.
Mrs. Leslie, thank you, Hannah. I would really love to now switch it over to Claire, who I know had some questions for our panelists, and to bring up any other discussion points that we think will be really important to share with our audience today.
Hi, this is Claire. Yeah, let me just share my screen. So we do have a couple of questions that we sent over ahead of time, just prepared, that we can talk about as a full panel. So the first question being, where do I even start? So whether somebody has lived in Massachusetts for a while and is seeking gender affirming care, or if somebody doesn't really know the landscape here because they just moved here, whether for college or for some other reason, where to begin with any of this? And yeah, does somebody want to start taking a crack at that?
Yeah, this is MG. Claire, do you mind if I share my screen real quick?
Not at all. Let me.
Perfect. Yeah, I just wanted to highlight some of MTPC's partners that are related to physical, mental, and behavioral health, and providers that we have partnerships with, as well as some members of the Trans Health Coalition, because I think that just having kind of a general list of places that are, we don't necessarily endorse any of these places, but we have strong relationships and have connected with them in the past. And so that speaks to some track record of gender affirmation and trans inclusivity. Uh, One that has been a sponsor for some of our fundraisers and programs for a long time now is the Meeting Point in Jamaica Plain. They offer behavioral and mental health, especially and specifically for LGBTQ people and disabled folks. And my therapist is from the Meeting Point, so I also have that personal connection, and think that this is a great place for folks looking for mental and behavioral health, whether that's a therapist, psychologist, or a psychiatrist. They have open availability and a number of providers that are culturally competent. A more recent partnership that we have is with Trans Health Northampton. So this is for folks outside of the greater Boston area, because we know that location is definitely an access issue where so much of gender affirmation care is located in Boston. And so our folks, our friends in Central and Western Mass are often kind of forced to commute long distances or not receive the quality care that they deserve. And so wanted to highlight Trans Health Northampton as a great starting place, especially for individuals that may need letters for gender affirming care from a physician or a psychiatrist. They have specialists who specifically write letters. And also, I mentioned the Trans Health Coalition earlier, where we have that open forum on info@masstpc.org that people can start with questions to. And then also have a general list. This is not comprehensive as we have over 60 members in the coalition, but highlighting some of members that regularly attend meetings and participate, including Fenway Health, the Center for Transgender Medicine at BMC, Boston Children's Hospital, Planned Parenthood, like Claire mentioned earlier, Boston Healthcare for the Homeless, and a number of others. And so Trans Health Coalition members are great resources for finding a provider, as well as some of them being providers themselves.
Yeah. Hannah, I don't know if you wanted to, this is Claire. Hannah, I don't know if you wanted to jump in with that or with something, or just I can talk about it a bit. All right. Let me share my screen one more time. One thing that, just to, do my job for a second, I do want to plug our own trans health program. I would not feel comfortable working here if it was not a program that I felt comfortable recommending. So for folks specifically in the Central Mass, sort of Worcester County area, the Kennedy Community Health Center Trans Health Program, I can absolutely recommend, and I will put the best way, if you're looking to become a patient with us, the best way to start with that process, if possible, is to go through our queue line, and I will put the information for that in the chat. I will also include my email as well, but my email is not HIPAA protected. So if you're a potential patient and you can use the queue line, that's probably just easier for us to work with. In general, though, what I would say the real answer to this question is community. Finding word of mouth is huge. Talking to other trans folks around you is huge, whether that's in a peer group or some sort of formal organization or a political group or just informally meeting people. Word of mouth is a really great way to find out about other resources, both to find out about things that are out there and to find out, not everywhere does provide gender affirming care. And so finding out how to navigate that and understanding that other people are also having the same experience can be both practically helpful and just really affirming in terms of understanding that it's not just you who might feel negatively about something. The only community advice that I would ever say to take with a grain of salt is if somebody's telling you that something is impossible to find or impossible to do. Very few things in the field of gender affirming care are impossible to find, particularly in Massachusetts, where there is a lot of coverage. And so that would be the one thing where, you can recognize that that was somebody's experience without expecting that to be your experience, because there are so many resources out there. Also, NPPC, the organization that MG works for, is fantastic. I have nothing but really great things to say about them and the resource list they compile and all of that. Yeah. That's what I had for this question. People have other thoughts on it. Okay. Going to the next and the only other panel question before we go into maybe more of a Q&A. What are some common barriers folks run into when seeking gender affirming care? I can start, or if you want to start. I guess, so common barriers, just because there is a way to access a lot of these resources doesn't mean there's an obvious way to access a lot of these resources. And so that's where community support, looking around, finding online resources and people in your community you can talk to can be really helpful. If you have a gender affirming care provider and are just looking for another outside service, asking your provider if you can meet with somebody from their social service department can be really, really helpful in getting other referrals. Then just kind of asking friends, posting online. There's certain things for certain, and so just getting through that information barrier has been huge, particularly because there are a lot of kind of myths floating around about, I've heard people say things, and, a lot of times when there's a myth going around that, for instance, folks who identify a certain way can't access care, that's because that is the experience in some places. So, for instance, there are some providers who might end up being more restrictive about, oh, well, everyone has to identify this specific way in order to receive care. That doesn't mean that's what the field is. That means that's the provider who has decided to gatekeep. And, in my opinion, that's the provider who's decided to not do their job, because their job is to care for their patients. And so realizing that a lot of barriers that you might run into with one individual provider, whether that's a therapist or a doctor or a surgeon, might not be kind of a universal barrier, is also really important. Because, and so I guess I'll say, for instance, for our program, we call ourselves the Trans Health Program is our official name, but it's a trans and gender diverse health program. The criteria for being included and receiving services is wanting to be included and receiving services. Even if somebody says, well, I want this kind of gender affirming care, or I want to go on hormones, but my sense of gender, it's more complicated. I don't necessarily self-describe as trans. That's fine. That's not an issue. And I'm talking about our program because it's the one I know best, but a lot of places are just as inclusive. And I've been really excited to meet a lot of really, really dedicated, passionate, inclusive providers at a lot of different places.
This is Hannah. Claire, I appreciate what you shared, especially on the latter end, as someone who is on the provider side of things, seeing a lot of queer people coming for different care needs that are under that umbrella of gender affirming care. I think for me, it's but when I look at even the question and the conversation points, I start with a question of like, what does gender affirming care mean to the individual and the individual person in front of me who is my patient? And I also, and that really has everything to do with the individual, not specifically something to do with my interpretation of their gender as they describe it, with terminology or common categories of gender, for example, like transgender, non-binary, etc. It also acknowledges that gender affirming care is something that every human needs and deserves, but it's only afforded to and enfranchised to primarily like sex and gender majority folks. And it's not called gender affirming care, it's called healthcare. So I start from a place of acknowledging that gender affirming care means something unique and specific to the individual in front of me, both in terms of how they present and exist within the world around gender and sex, and also how their body works and functions and exists, and knowing what that is to their health. And that's how I practice. And that's what gender affirming care really means to me. If that makes any sense. In a sense, it makes sense in my mind, and I think about it a lot. So I think when it comes to common barriers that I see when people are seeking gender affirming care, it often starts with trying to communicate once they're in that like clinician space with me and in a clinic or in the virtual space around what they want and what they need around their health and how I can support that. So finding the words and the language to communicate that with someone else, finding the strength and the beauty and the understanding of self and others and trust to do so is also another piece. And I wouldn't necessarily say those are barriers. I think those are just sort of processes that I see, but they're very common. And one of my goals and roles in as a gender physician, especially seeing queer people, is trying to cultivate like comfort in interactions with me so we could explore that together. Sometimes that means I meet people for the first time in a clinical space. We talk about hormones and they start hormones. Sometimes it means we talk about other aspects of health and primary care and other things, because I also do primary care for queer people. And then down the line, maybe there's a conversation around top surgery or something else, or other gender specific needs like contraception or menses management, things like that. This is getting a little bit into like the physician side of things, but one other thing I will say is that a really common barrier I see is wait times to get in to see clinicians, whether it's behavioral health providers or medical providers. And that's not only for pediatric patients, but for adults. So figuring out what your timeline looks like and can look like is important as you figure out where you want to go to access care, and where you can go to access care within Massachusetts. Fortunately, there are many options. Some of them are geographically constraining, and also come with wait times.
This is MG. I don't have much to add on that point, but second that, and was going to mention wait times as well. So I'm happy that Hannah covered that.
Yeah, this is Claire. I do want to agree with that. I think on the medical side for hormones, wait times, thankfully, in most places that I've seen recently have not been, it's been a question of days or a couple of weeks rather than months. But that's also going to be geographic. It's going to depend on what people have access to. So I don't want to say that's universal. And yeah, for behavioral health care or surgeries, the wait times do tend to get longer. One really great resource I just want to plug here is the Gallup.org. That's THEGALAP.org. And that's the Gender Affirming Letter Access Project. And that's a list. It has a list and a directory of behavioral health providers and therapists in Massachusetts who have committed to making it easy to get support letters if folks need them to access gender affirming surgery or other care. And that has been a really, really great resource because of how long behavioral health wait times can be. Yeah, Steph just shared it in the chat. Really, really, really great resource. Highly recommend, particularly if wait times at a place where you're receiving care already for behavioral health care are really long. I guess that's pretty much everything it seems like we had on this question. I don't know if we're going to a break or opening up for questions from the audience or anything like that.
This is Leslie. Hey again. We're going to go ahead and take any questions that came in or that will come in as we speak. So one thing that I know we get a lot of questions about through my ombudsman is how can I make sure that I'm eligible for the procedure or service that I'm looking for, and not talking about insurance so much, but what do I need to do to get ready for any services and be prepared to answer?
Hi, this is Claire. I guess just to ask a question back, what sort of services does that question usually come around? Because, for something like hormone therapy, my list of sort of things that people need to know coming in is probably kind of short because so much of that information is relatively done in a relatively similar informed consent way. Whereas for something like surgery, there's maybe a longer list of kind of research around the bureaucracy of it to do beforehand.
This is Leslie. Thanks, Claire. It is usually around questions around surgery and reassignment. And I think that most of it is, folks who are still maybe they're under 18 and they're wondering, okay, what can I do to get, start getting prepared once I am of age for some of these services that I'm able to get without parental consent. So it is usually around surgery.
Yeah, this is MG. One thing that I wanted to note in preparation and that related to barriers, one of the previous questions was fat phobia in healthcare and specifically in gender affirming care. And I think it's really important to note that while some physicians, surgeons, providers have kind of BMI requirements, not all do. And there's actually a lot of information on debunking the links between like BMI indexes and gender affirming care. And so I wanted to kind of note that folks shouldn't feel like that's part of the preparation that's needed of weight loss or anything, but that shouldn't be a barrier if you're going to the right provider.
Yeah, this is Claire. I just want to echo that. Another great example of what one provider tells you is what one provider tells you. People have all kinds of BMI requirements for different surgeries. It really is because there is this profound kind of fat phobia in healthcare in general. But that is not everywhere. One that springs to mind because I know that they take a lot of different insurances, including Mass Health and Health Safety Net, and don't to my knowledge, have any kind of hard BMI limit is Children's Hospital. So there are really major hospitals, surgeons, providers with a lot of experience who will absolutely not see that as any kind of hard barrier. So, but unfortunately, like MG said, there are too many that do. And so that would be a good reason to look to another surgeon. Yeah, in terms of surgery, I think establishing a relationship with establishing a relationship with a primary care provider that you trust for gender affirming primary care, and establishing a relationship with a behavioral health care provider that you trust for who is also gender affirming. Both of those, I know, certainly easier said than done, but I think that having folks sort of on your care team who have worked with people going through the surgical process before is huge. In terms of research, just finding a few surgeons who you might want to work with. Unfortunately, because I always feel weird recommending it, Reddit.com has overwhelmingly the most information on gender affirming surgeons of any website online. I don't know why that's the case. I kind of wish it were anywhere else because of my own personal feelings about Reddit.com. But Reddit.com, the Redditors, the posters there are really doing their work to get that research out there. So I do have to give them a shout out for that.
This is Hannah. I don't know that I can plug Reddit, but I know there's a lot too, because people come to me with a lot of stuff that I'm so impressed what I hear. I do want to just like make a clarifying comment too, to the fact that like we're talking about a lot of different surgical things here. I think generally the big buckets for gender surgeries are facial, chest, and like genital surgeries. And then there's a huge range of different procedures, even within those umbrellas. So let me give, like, for chest surgery, like there's nothing really like someone needs to prepare for if they want a chest reduction surgery or a mastectomy, other than you don't need, like, medically speaking, the medical criteria, which are often tied to WPATH requirements, and also are what the insurers use to authorize these procedures. And often surgeons use to like make sure that they're doing this per best practice standards. You have to have a medical diagnosis of gender dysphoria. So having a readiness to know that care is going to be billed under that diagnosis, I think, is an important consideration to prepare for, and something that I talk a lot with patients about. That we need to medicalize gender in order to enfranchise someone to surgical care or to other care around gender, if they're queer. And then have stable medical and mental health needs and have a letter. And like that's the criteria for like chest reduction surgery or mastectomy. So like that's just one example, but that's specifically to that kind of surgery. I think the number one thing I would prepare for, especially for youth coming into adulthood, is if you desire not to pay out of pocket for surgical care, which you ought not need to do, have insurance. Get Mass Health. I'm not plugging for Mass Health. I don't work for Mass Health. Like, that's not what I mean. But like, Mass Health will cover your care. Or make sure you work with your employer if you have an employer or your school to understand what your health insurance options are and what like surgical care or medical care around gender needs is covered under that plan. I think that's the key thing that I would encourage youth to keep in mind as they're pivoting into that 18+ year old phase where they're legally adults.
Yeah, this is MG. Just one last thing I wanted to mention, and I'll put it in the chat as well, is MTPC's community calendar. So much about gender affirmation is being in community spaces with other folks and shared experiences, similar experiences. And it's often difficult to find connections to trans, non-binary, and gender expansive individuals. And so I'm putting our community calendar link in the chat. And these are great places to connect with people both formally and informally, to see, to have some solidarity among being trans and being gender expansive.
Mrs. Leslie, awesome. Thank you so much to our amazing panelists who clearly have a wealth of information and have been generous enough to share your perspectives, as well as what you have found really works for a lot of people. And totally appreciate also the fact that Hannah, you pointed out that we're really talking about really individual circumstances and different procedures that really are different for everyone. So just echoing what MG and Claire have said about making sure that you take a look at the resources that we'll provide here in the chat, as well as what we'll be sharing after day 1 and day 2 events are over. The next event is on Saturday, where we'll be discussing health insurance. So as Hannah was talking about, having health insurance is super helpful. But just wanted to rehash what Claire and MG said about having community and having a care team, care providers already on your side as you're thinking about going through any sort of gender affirming care. Just having that as a strong foundation seems really important. So thanks for sharing all of this information. And we're going to actually now switch over to our second panel. So once again, thank you, Claire, MG, and Hannah. You've been wonderful. And we will share your information later on. Thanks again. So for this next part of our panel on what a healthy doctor visit looks like, we have Steph DeNormand from Fenway Health and Dallas Duker. I'm sorry if I mispronounced that, and I hope you will correct me if that is the case, from Trans Health Northampton. So I will let you all take it away. Thanks, y'all. Take it away.
Awesome. Thank you so much. I am going to start sharing my screen, and then we will have Dallas start us off. Alrighty. I believe that you all should be able to see my screen now. My name is Steph DeNormand. I use they, them pronouns. I am the manager of the Trans Health Program at Fenway Health. And I am very excited to be joined here today by Dallas Duker to talk about what a healthy clinical visit looks like. Dallas, go ahead and take it away.
Hey there. So my name is Dallas Duker. I am a trans woman and I use she, her pronouns as well, along with Aya series. And I'm the CEO at Trans Health Northampton. We are a new nonprofit independent clinic that serves over 1,500 transgender diverse folks. We started last year, see folks primary care, mental health care, psychiatry, and over telehealth or in person, do surgical referrals, community support services, clothing swap closet, medical legal support. And I'm grateful to be here. So some kind of common vocabulary or abbreviations that you might hear in this talk, or just in general, our provider, care team, or clinicians. So just wanted to mention these. A provider, it's really someone who, like a doctor or an NP, nurse practitioner. I myself am a nurse practitioner, a PA. It could also refer to someone who's your therapist, someone who's helping you with mental health issues or concerns or needs, or also importantly, working to affirm you, right? And be really, maybe you're not coming in with any problems, and maybe it's just like to be there and talk about life too. There's also your care team. So that's just the entire team. That includes anyone who's working to really take care of you. And then also a clinician too. So anyone who's a healthcare professional that's qualified to practice healthcare. So you might hear these terms throughout this talk, and just want to, mention these. So what does a good visit look like? I really believe, I think Steph and I both believe that a good visit involves informed consent. And informed consent has been seen as something that is, at least by people in the medical community, as like a piece of paper that you sign and you understand exactly what type of treatment is happening. But I believe that informed consent is so much more. And I think that every trans and gender diverse person deserves true informed consent. And so it means that you actually are able to decide what you're getting in the treatment. It means that you are put in the driver's seat. You decide what happens. No one else gets to decide that for you. And that means, importantly, that we're removing barriers, removing gatekeeping, and making healthcare a space that you actually get to be in full control of. And that's what a good visit looks like, right? Now, obviously, there might be things that might be medically harmful, and that might go against the oath to do no harm. So that's a little different. But if it's not doing any harm, you should be able to get what you want, right? You're the person that's in control here. And so that does mean any clear information about your meds, your referrals, who you should get care from. It also is consent on how you're referred to, right? And not only how you're referred to in one space, but every space. So how you're referred to in an exam room, how you're referred to in a lobby, how you're referred to if you're inpatient and being referred to in front of others, right? You may not be out in all spaces. And so it's really important that there's consent in all of those spaces, and also when you're referred to in that way. So it's not something that just is a specific point in time where informed consent happens one time, but it's at all times, right? It's also, informed consent in terms of how someone touches you, right? Or if they touch you, or if they don't touch you, right? Providers and clinicians and care team members come into spaces with a lot of privilege they don't always recognize. And so it's so vital to be able to have a conversation about when someone can touch you, when someone cannot, when someone can refer to you in a certain way, when someone cannot refer to you in a certain way. And then also at the same time, you deciding when you pause, when you stop, when you continue, really leaving it all up to you. Because at the end of the day, that's what this is about. It's about providing you good care. It's also, a visit that is trauma informed too. And so what does that mean? At least in the healthcare community, that means that we assume everyone has experienced trauma. You enter the room with that assumption because you just don't know. And sometimes asking people can risk re-traumatizing them as well. So this isn't just one person that's saying that they are going to do this. This is an organizational commitment to being able to provide care that is trauma informed. This is operating with the lens of not of what happened to you rather than what's wrong with you, right? So it's really asking about the important and relevant details that are pertinent to your care, and how those have directly affected you. But it's not approaching a clinical care visit with this, what some folks in healthcare call pathology, a lens of pathology, right? Of this is wrong. A lot of healthcare providers, clinicians, team members are taught to look for what's wrong. Look for someone when they're in distress. Look for someone when they are having difficulty breathing, right? Or maybe chest palpitations. And that's important. But that training and that lens can also really reinforce this philosophy that the patient is always coming in with something that's wrong versus something that's right. And so when we're being trauma informed, we're not presuming that there's something that's wrong with someone, but instead something that happened, right? And that there is hope, there's recovery, right? There's a possibility in the future where we can change, we can grow. And that starts with the lens of everyone having experienced trauma. And so those principles then include, first and foremost, safety, right? So I start as a provider in saying, I understand that this is not a comfortable space. What can I do to make this more comfortable for you? I recognize that coming to a healthcare environment is not going to be the most comfortable space. It's not like going to a friend's house. So what can I do? How can I respond? Giving the person choice, right? Working with them as a partner in their care, being trustworthy or trying to, and always, always, always focusing on empowerment. Here is what you are able to do to forward your care, and here's how I'll be a partner with you. A healthy visit also includes principles of harm reduction. Whether it's hormones, whether it's drug use, whether it's anything else, you should always expect a clinician to meet you where you're at. And so harm reduction is a general philosophy that it started around drug usage, but it really can be applicable in all sorts of walks of life, right? It's really a non-judgmental approach to saying, we understand that people sometimes choose to do things that could be considered by some to be harmful, and that's okay. We're not going to stigmatize or judge people based on their own choices, right? It's really saying that you as a person, again, have the freedom and the liberty and the choice to be able to do whatever you want to do. And with the knowledge, the clinical knowledge that a provider or clinician or team member may have, we will help to figure out the least harmful path while still respecting your choices. And so that's really focusing much more on well-being. It's really focusing on what you want. It's really focusing on your relationships to yourself and to your community. And it's recognizing the reality of racism, of social isolation, of trauma, of discrimination, of inequities, inequalities, of poverty, and saying that there are some times that we make choices that we have to make based on where we are in life, and taking a much more systemic approach rather than just blaming the person, which is what has traditionally happened in healthcare environments. That also means that services really should be provided with very little barriers, and they should be accessible too. And so this really requires people to be working on what you need without working in black and white thinking. It's considering the possibility of a both and in care. It's not following some type of algorithm necessarily, but saying that you could choose to do drugs, for example, and choose to also live a healthy life, and that's completely fine, right? You can choose to engage in sex work and choose to have a healthy life, and that's fine. There's no judgment here. It's just really respecting your own choices. And I think what we all are really striving for, at least I think what's so unique about the gender affirming model itself, is it's one that, again, does not center pathology. It's not one that centers what's wrong with you, but it really says what's right with you, right? You get to be put in the captain's seat like you should, and you should be able to direct your individual ship wherever you want to go. And so the basic thing that you should, require from any type of clinical visit is safety. Safety to be able to not be discriminated against, safety to not be refused care, safety to be able to work with insurers and, actually have insurance that then really respects your own life choices and your own identity and helps you get what you need because you're insured by them. And that is the bottom line. Unfortunately, for so many trans and gender diverse people, it's, a very common experience. Around 60% of our population will experience discrimination, and it's higher if you are a person of color, much higher. And so I really challenge all healthcare providers, clinics, organizations to raise that bar. And it's not just about fighting for safety. It's not just about fighting for non-discrimination. It's not just about making things aware, which is the second level here, right? Culturally competent, consensual, or educational. That's great too. But we really, those are still kind of the floors. The ceiling is affirming care. It's a place where you can be creative. It's a place where you can be authentically you. It's a place where you can be explorative. It's a place where you want to be, right? You're not only receiving healthcare, but you're actually able to express your whole identity. And I don't know about other folks here, but myself as a trans woman growing up in Central Virginia, I thought the ceiling was just getting hormones. I thought that was the best thing ever until I realized how much better healthcare could be. And so I think this is a real possibility to push not only gender affirming healthcare, but all of healthcare to just do better and stop putting people in boxes and stop being a box to be checked, but instead to see the person as a whole person, recognizing that whole person, putting you in the driver's seat and working to provide the best possible life ahead that's defined by you. Care is also respectful, right? Respect is something that we don't talk a lot about in healthcare settings, but you're a person who deserves to be able to determine what you want, when you want it, how you want it, just like anyone else. And so it really, really matters that you're able to get caring and compassionate healthcare services. Respectful care acknowledges the fact that there's a lot of complex needs. There might be, chronic trauma. There might be, different medical or physical complaints that you might be working through. There might be, real questions around identity and what it means as a person, as a human being. And so to not just try to shove those into a very quick assessment, but be able to take the time, be able to be present with you, be able to talk with you and not about you. It's a very common thing in healthcare settings for people in general, especially providers, to talk about people, to do rounds about people versus have conversations with them. And so it starts by actually having a conversation. And so in that visit, you should be really expecting that provider or that clinician or whomever to be talking with you, having a conversation, listening to you, understanding you, being compassionate, and also importantly, protecting your privacy, right? I mean, this is where trans broken arm syndrome comes from. This idea that we're supposed to be objectified in some way or a case study versus actually seen as a human being who needs healthcare, whether it's related to gender or not. And so respectful care is just, again, bottom line, right? All of this together, just put together, is just what needs to be expected at the very bottom line. And I would also say, especially now, more than ever, healthcare organizations have tons of money. especially healthcare organizations that are a part of large, traditional, academic medical centers. They're very well endowed. They have a lot of big donors, and they really honestly don't put a lot of money into gender affirming care compared to what they could be doing, right? A lot of times, though, tout the fact that they do gender affirming care, but not actually really devote the resources. So it starts with having a very outspoken and unified group of organizations, clinicians, providers, people who are in your corner, and not only speaking about it and not only relying on those loud voices, but then also really devoting the resources to it too. We need healthcare organizations to show up. And places like obviously Fenway and Trans Health are 100% showing up. But there are so many other healthcare organizations across the United States that invest in their surgical programs, but do not invest in their political advocacy and do not invest in robust mental health care and primary care. And so we need to expect that the places that we receive care from as an institution, as an organization, are the ones that will be devoted to showing up for all trans and gender diverse communities. There's so much money that they spend on lobbying. They can easily spend that on trans and gender diverse folks and LGBTQ folks. So it's hospitals, community health centers, clinics. Everyone needs to see advocacy as part of their mission. And also importantly, as a part of public health work. Just imagine, just remember maybe, or imagine what it feels like to be able to make a difference, right? It probably feels good. It probably feels good to be able to change something in the world for the better. I would argue that that is a healthcare intervention, right? That is something that will make you feel better. So if we can show up together and we can make a difference that's in line with a politically active mission to fight for trans health, to fight for trans justice, trans power, trans youth, whatever it may be, and we're all in this fight together, then that is a public health intervention. And so we should expect these larger organizations to show up. And that means devoting resources, working with these organizations, and really at the end of the day, coming back to the very, very just core concept that gender affirming care is not something that needs to be segmented out from everything else, right? That is a form of othering. This is just good healthcare. There was a time in the past when diabetes was considered a very specialized illness. And now we treat diabetes everywhere. If we want to get to the place where we can provide good gender affirming healthcare everywhere, then that requires really baking this in everywhere and really requires organizations and institutions and boards and everyone in between to show up. So if you were to walk into your provider's office or clinic or somewhere, ask how they are getting involved in protecting trans rights. It's their duty to respond to that, especially now more than ever. We need everyone in this work together.
This is Leslie. Thank you very much, Dallas, also for giving us this call to action. I'm not sure who in our audience might be additionally, part of organizations, part of these larger groups that do have resources to devote to making sure that healthcare is accessible for everyone, and totally reaffirming the statement that gender affirming care is just good healthcare. Yes, for everyone, So thank you for making that so loud and clear. All right, so let's take it away again, Steph. and then we'll follow it up with questions.
Yeah, thank you, Leslie. This is Steph taking back over again, and I'm going to start sharing my screen again. There we go, and that should be sharing. So to follow up and continue on what Dallas was saying, one of the other things that I think is really essential to having a healthy clinic visit, having a healthy visit with a clinician, is that it is accessible. And I mean this in a really expansive way. So things like speaking your language, that can be literally having either translation services or having a provider who speaks your language and is able to provide that clinical visit in a language that you understand and that you're able to interact with. But also speaking your language in the sense of being able to communicate with you in ways that you understand and that feel right for you and your body and how you interact and think about yourself. Being able to meet requests and reasonable accommodations. I'll talk a little bit more about this in a second, but thinking about the various different ways that you can be as comfortable as possible within your clinic visit. Dallas also talked to this a little bit in talking about trauma-informed care and harm reduction, but what does it take for you to be able to be in that space with that clinician, again, either via telehealth or otherwise, in a way that feels as comfortable as possible, where you're able to get your needs met? It may not always feel like your buddy and like your clinician is your best friend, but being able to feel like you are being heard, like your needs are being met, and that you feel comfortable to express what those needs are all really essential pieces. Being responsive to your needs also goes right into that, along with, as actually multiple folks have mentioned at this point, being able to do things like getting appointments, getting a hold of your care team or your clinician when you need it, when you have a question about your care. These are all really important parts of being able to have a healthy relationship with your clinician and with your care team as a whole, but also as important for you to feel like you have that ability to ask questions when you have the question, to get the answers about your health and safety when you need those answers. Accessible also means flexible. So things like having a variety of different kinds of appointments available, having different times and days, being able to have having different kinds of settings for that appointment, whether it is something like maybe you need a longer visit to be able to get your thoughts out, being able to have different ways of communicating and working with that provider are all essential pieces of that as well. Some things that I know that we might talk about with some folks are, what are your best communication styles? Do you like to kind of write stuff down and think it through? Do you really like to take notes? Or do you like to go into that visit and just kind of, have on your head what you got to talk about and just start going for it? What does it look like for you to be able to communicate? And you should be able to expect that your clinician is going to match that and work with you in those ways. Similarly, being person-centered. So really understanding you and your needs. I say all the time, I do not an insignificant number of training for clinical providers to hopefully get them to match the talent of the folks that we've had in our panels today. But talking to them about, I can teach you up and down all day what we see in communities or what some common needs are and things like that. But if you as a clinician are sitting in a room with one person, what that one person needs is all that actually matters in that moment. Thinking about and focusing on the individual person is what matters. And that's what I would want you to be able to expect out of a clinician who you are seeing or out of a provider who you're seeing. Being able to understand what your individual needs and goals are and working with you in a collaborative way in order to help to achieve those goals. As some of our panelists in the previous session were talking about, it is very rare, especially within the field of gender affirming care, that something is fully impossible. It's really pretty rare that that happens. A lot of the time, we might have to think creatively. We might have to think about what are ways that we can, kind of play with the resources that we have to get where we need to get. But rarely should you be getting an absolute no, that's impossible. That's not even something we should think about. What I would encourage is expecting that your provider is willing to tell you what the options are, as opposed to telling you what you can't do. Being able to make sure that you understand exactly what it is that is doable within our current medical science, within the current resources within the area, whatever it is that you individually are seeking. And that if that individual clinician doesn't have the resources needed, that they are going elsewhere, that they are advocating for you, or that they are reaching out to their networks and resources to continue to make sure that you are getting what you need. Also focusing on not only your safety within something like a clinical visit, but also your comfort. Making sure that, the quote unquote little things of, giving you a moment to collect yourself, being able to take out your phone if that's the way that you are feeling most comfortable to sit in a visit, whatever it is that you individually feel most comfortable with. If that means bringing someone along with you to that visit, if it means going slow through a particular exam, or if it means putting off an exam for until next visit, or until it feels like something that's doable, or until forever. Any of those things are things that a clinician should be listening to, should be hearing, might give some suggestions on, would this help, or would this be able to shift how you feel about it? But at the end of the day, it's your choice to be able to decide what does and doesn't feel okay, what is and is not within your current goals as a clinician, or as a patient who's working with that clinician. Your needs as a person come first. And that's really kind of the core of that person-centered care. You should feel affirmed. You should feel like your care team is respecting you and your gender identity, as well as anything else, maybe neurodivergence, maybe other accommodations that you require. Whatever it is that, again, helps you to feel most comfortable and able to be engaging in that visit should be respected, should be prioritized in your process of accessing care. The next couple slides are a little bit of a divergence from the rest of this conversation, and this is more, what if all of the things that Dallas and I have talked about aren't happening? As I said, there are some spectacular clinicians, both in medical and behavioral health, surgical, and kind of all across the spectrum in Massachusetts and, everywhere. But some of whom are on this call today, some of whom I am blessed to say are my colleagues. But there are also some folks who are not quite there yet, who might still be learning how to provide this care, or may not even have the desire to get that far. So what happens next? One of the things that I hear most frequently, and I know that comes out in our data as well, is a lot of trans and gender diverse folks end up having to teach their providers or their clinicians about their own care. Now, when we're talking about who's teaching who, what I like to say is that you are the expert in you. I actually wouldn't want a clinician to meet you for the first time and say, okay, I know exactly what you need. These are the hormones that I want you to be on. These are the surgeries that I think you should have. This is what you should change your name to. Like, those things don't make sense, right? You are the expert in what your needs are. You are the expert in what feels right for you. So sometimes that can feel like teaching a little bit, being able to explain to someone how you feel. But that's a very different thing than having to teach someone about everyone who is trans or gender diverse, or teaching someone about how a hormone works, about what appropriate dosing schedules are or labs are, teaching someone about risks and benefits of a medication you're interested in. These are not things that you should be expected to have to do. as in that circumstance, a patient or as someone who is seeking care. These are things that really the clinician and the care team's responsibility is to understand. Now, not everyone can know everything. So sometimes that response might have to be, you know what, I don't know much about that, but why don't we schedule another visit and give me time to research and reach out to some experts? All right, I can deal with that. But you shouldn't be in a position where you have to teach your clinician about gender affirming care, about your medical needs, your behavioral health needs. That is simply not appropriate. It's not something that we expect in any other aspect of medicine. And it isn't something that you should expect out of your clinicians either. Now, kind of the next step beyond that, beyond just, someone who doesn't really know what's going on, but really feeling like your needs are not being heard or not being valued. I like to make sure that folks have the resources, or at least have a handful of things in mind of what is the next step. Some of our colleagues earlier did a great job at talking about how you can find other clinicians or how you can find other places to go. Some folks will also want to provide feedback in a variety of different ways to the folks that they've seen. That can be on a really broad spectrum. One of the things that I like to say is that if you have a visit where you didn't feel comfortable, you are not obligated to see that clinician again. You are not obligated to go back to them. You're not even really obligated to provide feedback or to report something if it felt reportable, if that doesn't feel like something you want to do. It is always your choice what you would like to do as your next steps. If that means, ghosting that provider, disappearing from that person's view and going to see somebody else, finding a resource like the Massachusetts Transgender Political Coalition, like some of the patient advocacy programs that exist at Fenway Health or at Edward Kennedy, some of the folks who've been represented here today, or Trans Health. I know that they also have similar programs, being able to help folks to navigate these systems. Any of us are always happy to do that. But there are other things that you can consider doing as well. Some of them are reporting your experiences or describing those experiences to places like the Massachusetts Transgender Political Coalition, where we can, keep track of where are we seeing trends. I know that they have done a spectacular job at keeping track of some of those things and being able to make sure that communities are aware when there are problems that are happening in particular areas. Places like Health Law Advocates is one example of some great legal advocates that can help to navigate situations where that might be helpful to have kind of that legal support. The Attorney General's office is a great place to report things like discrimination when things aren't going well within a visit in kind of that more significant sense. Other things that I usually like to mention are that as someone who is often on the kind of the receiving end isn't the right word, but often gets to see and process a lot of the patient feedback, or sometimes described as complaints, to health centers. I actually love when we get those because it is really rare that we do. It's really rare that we are actually hearing what's happening in those individual visits. And I can't try to work on getting something fixed unless I know what's happening. So I absolutely love when people feel empowered enough to seek out how to submit that formal feedback, so that I know what happened between you and that clinician, or what happened between you and that nurse, or you and that patient services person, or whatever the circumstance is, so that it can be fixed and you're the last person that happens to. Similarly, positions like mine and my team, in-house advocates and navigators, designated patient support people. A lot of the time these exist not only within primary care centers, but also there is often some kind of patient advocacy within hospital systems also. Sometimes they are trans and gender diverse folks specific, sometimes they're a little bit broader, but either way can also be a great way to report an experience. Where different people are going to see it and possibly be able to address it on a larger level than if you just were to say to that person, the clinician, like, hey, that didn't feel good. which obviously you're also fully welcome to do, and I would encourage folks to do when they feel like they can. The last piece is finding community support, whether that is through friends and chosen family, whether that is through things like support groups, finding places where you can feel heard and valued for who you are, especially if you are in a circumstance where your care is not going well. Being able to have those other supports to lean on. I cannot speak enough for the value of things like community and peer support. So are things that, a couple examples of things you may consider, but are some examples of things that can be helpful in these circumstances for some folks. And then that last piece, I kind of mentioned it a moment ago, but the last piece that I really want to talk about is self-advocacy. All of the other tools that I mentioned before are other examples and tools that you can use, but I really love when I am able to help someone, or when someone is able to themselves take on that advocacy, be able to really speak up for themselves. Self-advocacy can look like a ton of different things. Some of them are things that I talked about earlier, like filing a formal complaint, requesting a second opinion, asking for help from one of the many organizations that you've heard from here today, or that I listed just a moment ago. Self-advocacy can look like a lot of different things other than that also, though. It can be something as simple as taking notes when you're in a visit and keeping track of what's being said and making sure that you're listening and paying attention and holding your provider to making sure that you understand the care that you're receiving, or that your provider is listening and hearing your needs. It can be things like asking questions. Part of informed consent, as both Dallas and Claire were talking about earlier, is understanding the care you're receiving. And that is something that you deserve to understand, particularly when there are things that are happening to or with your body. That is fully within your rights, and you should be able to expect that that is something that you will be able to have access to, that information. So I would encourage you, ask as many questions as you need to in order to feel comfortable with whatever the next step is for you. Sometimes that means that a visit runs long. Sometimes that means you got to schedule another visit. All of those things are okay. And what's most important is that you have the information and resources you need. Similarly, self-advocacy can look like expressing your needs, expressing what you need in a particular moment. I've referred to a couple of these things already, but doing something like bringing a buddy along, whether that's for every visit, just as having somebody who can take those notes for you, who can say, oh, in the car on the way over here, you had this other question that we forgot to write down. Do you want to ask about that now too? Having somebody just to hold your hand for a sensitive exam or procedure can be helpful as well. Other things might be communicating your needs or priorities ahead of time. Some of the folks that I've worked with have found it really helpful to do something like send their clinician a quick email before their visit to say, hey, these are my priorities for this visit that's coming up. I want to make sure that I have it written down and we both have it, so that we both know coming into our visit tomorrow, this is what I want to talk about. And then, as I also have here, multiple visits before, quote unquote, doing anything. I have that in quotes because the conversation is doing something. It is you learning. It is part of that relationship. And it's also part of the clinical care that is being provided, is education and being able to learn about what your options are. You should never feel pressured to make a decision, to feel like you have to make a decision today and start a medication today, or have to make a decision and sign a piece of paper saying that you understand today. Those things are never things that should be happening. Making sure that you are feeling ready and comfortable for anything that is happening, again, to or with your body or about your healthcare, are all things that, if I could give everyone the power and strength to feel good and feel like they're able to say those things in a visit, I would do it in a second. And I think that a lot of the time it can be scary because, as Dallas said, it's not uncommon for folks to experience discrimination or various different kind of poor experiences within healthcare. And then one other piece of self-advocacy that I mentioned earlier also is requesting a second opinion. Whether that is through the clinician that you're working with and saying, actually, can you refer me to someone else, a specialist or somebody else, so I can hear someone else's opinion, or if it is something where you just go see somebody else and see what they think. And I think it was Claire also who was speaking earlier about when you get one clinician or one provider's opinion, it is one clinician or provider's opinion. It is not always going to be 100% that every single, actually, I can almost guarantee that you will never find any decision that every single clinician will agree on. And being able to have that kind of internal sense of, you know what, this isn't feeling right. I deserve better. I want to go hear from somebody else. I want to make sure that I understand this better before taking those any additional steps. All of those are aspects of self-advocacy and are also all things that I know at least my patient advocate team and as well as many of the others I mentioned earlier are also happy to help folks kind of think through, make plans for before a visit, during a visit, after a visit, anything like that. And that's where I think we're going to wrap it. We certainly have a little bit of time, at least for questions. And I know that both Dallas and I would love to hear any questions that folks do have. I am going to stop my screen share at this point so that I can see the screen a little bit bigger. Yeah, thank you all for hanging in there tonight.
This is Leslie. Many thanks to you both, Steph and Dallas, for what was a really comprehensive presentation as well as a really empowering one. I think that knowing what to expect and knowing how to go about getting those expectations met when it's not happening is it's always really great to have options. So thank you. Before we go into questions, I just wanted to check with the audience and see if anyone is still using the Spanish interpretation. If you could let us know in the Q&A, just drop a comment if you are. So yeah, as Steph asked, if there are any questions, we'd love to hear them. I'll take a look at our question and answers here. So one question could be about how to be, in the patient's perspective, how to be more informed about what's going to happen. So this is, this presentation is already excellent in what a healthy visit looks like, and what might be going wrong and what to do when things are going wrong. What about when, you're not entirely sure, if this is right or this is not right? And I think seeking a second opinion has been something that's come up. But maybe what are some other questions that one can ask themselves as they're in an appointment, or maybe even before they go to an appointment? Like, what are some signs of a healthy experience going to that person's office or practice?
Yeah, I can start that off and then I'll hand it over to Dallas. So there are a lot of kind of cues, I might call them, of a place that's more or less likely to be engaged. Some of the things that I personally might look for are things like, does their website talk about the work that they're doing and the kind of care that I'm seeking? If I'm sitting in a waiting room, am I seeing pictures of people that look like me? Am I seeing descriptions of the kinds of services that I'm seeking? Something that I really like to see, particularly out of some of those, let's say, better funded programs, especially, is are they actively engaged in other things like research? Are they actively engaged in, do I see them being represented at different kinds of either pride events or sponsoring different kinds of events? Do I see indications of them being actively engaged in community? As far as when I'm actually in a visit, there are some of the kind of the, obvious things of, is this person asking me how I'd like to be referred to if they don't otherwise have access to that information already? One of the things that for me is always really important that might feel a little bit less specific to gender, but I think is as important is, do I feel comfortable asking this person a question? And that is something that, at least for me, like I said, personally, has always been kind of a good marker of like, do I feel like I can actually ask this person a question? Do I feel like I'm able to ask them something that they're not expecting? Or talk to them about something that they didn't plan for coming into this visit? Because again, this care, if I'm the patient, it should be about me. So I should be able to direct what the questions are and what our conversation looks like. And if I don't feel like I can ask a question in the course of a whole visit, something's not right. So those are some of the first things that I think of. But Dallas, I'm sure that you have other thoughts as well.
Yeah, I think that one of the most, I mean, a lot of this is not specific to being trans, right? Like a lot of this is just what would I want in any good healthcare experience? And part of that is, I think healthcare can be so fast moving. I would want people that are clearly slowing down and looking at me in the eye and talking to me and having an actual conversation and listening to me. I mean, that's what I look for really in a visit. This is not the gold standard, but I would look for, pronouns on ID badges, for example, not just like a sticker, but actually like on someone's badge. If, that shows an organizational commitment. The rainbow flag sticker is one thing, or the trans flag sticker is one thing, but that means that somebody put that on. It's a whole nother thing to see pronouns etched into a badge, for example, right? I would look for the diversity of the staff too, I mean, it shows an organizational commitment when folks are hiring. You won't be able to necessarily know if someone's trans or gender diverse or there's multiple different sexual orientations, but looking at least just the diversity of experiences or how people speak, or access to different language services to people who are multilingual or at least bilingual, especially at the front desk, right? But really across the board. And then, I really look for comprehensive services too. So not just a program that is just doing one thing, but a program that is really linked together in a lot of ways so that there are groups to each other. It's not like just going to one little segment of a space for one type of care. And I really do ask providers and clinicians, like, what do your patients say about this space? Like, I try to actually engage them in their own understanding of their feedback to try to figure out what that's like, or when they maybe send off a lab sample, for example, of my own labs, if they're trying to check my hormone levels or something, like, where does that go? Like, really trying to understand if they really know what's actually happening. So I really look for people to be able to be very curious about the place that they work and what the operations are, so that I know that they're making choices that are informed versus just kind of going through the standard protocol. I ask how long people have been doing gender affirming care. I ask, importantly, why they're doing gender affirming care too. I think you have the right to be able to ask these questions. Treat it like a job interview, right? Because this is your life. And you are paying money to be able to have access to these services. So you deserve to get to ask any question you want.
Thank you, Dallas. Thank you, Steph. Totally agree that we really, with all this knowledge, we hope that folks come away from this feeling that it is your right to get the best healthcare that you possibly can. And there are resources, communities, support systems out there that exist to help you with that. And so with that said, thank you so much to all of our co-hosts and our panelists and presenters today for making this event a reality. And all of you in the audience who stuck around, I appreciate it's past the time that we said it would end, but there's probably hours more worth of information that we can talk about. So if anything, we want you to take one more thing away from today is after day 2, which is on Saturday, where we'll talk about health insurance and your healthcare rights. We will be sending out a resource guide that includes the contact information of helpful resources and whatever information we are allowed to share from today's event, we will definitely share, including the recording. Please feel free to share it among your folks, people who you think could use it. And there are many ways we can continue to support gender-affirming care, specifically and safe access to healthcare for everyone, including trans people, by attending events like these, by supporting organizations in the resource guide, and more. For instance, right now in this moment, actually, there is a Facebook Live event happening to learn more about how to help protect trans and LGBTQI students as they return to school. And I actually put that link in the chat if you are interested in attending that Facebook Live. There's, again, through all of our community resources, I think we'll find more and more of these events happening, more folks wanting to lift each other's voices and just make healthcare better and more accessible for everyone. So I'm going to post the link there now. Just wanted to lift up that resource. Thanks. I think it was Steph who sent it along to us today. But yeah, let us know if in the meantime there are any questions. We're going to wrap it up for now. Thank you very much again to all our presenters, our awesome interpreters, and of course, everyone who's attended. We hope that we'll see you on day 2. Take care.
Take care.
Bye, everyone.